Hi, thank you so much for stopping by the channel. Today we are talking about gonorrhea. And there's this misconception that it affects men. No, it affects both women and men. So if you have sexual intercourse with somebody who is infected, you are likely to get it. Even if the person doesn't ejaculate, you will get infected. Yes, so be careful out there. And it's not only the genitals that can be affected. If you have anal sex, you will have the infection in your rectum if the person is infected. If you have oral sex, you have the infection in your throat. It can affect the throat, it can affect your rectum, it can affect even your eyes. And the obvious part, your genitals, can affect the genitals. So be very careful out there. Now let's move on to some of the symptoms of gonorrhea. Alright, so with the symptoms of gonorrhea, sometimes it may be asymptomatic. Asymptomatic means that you may have the gono alright, but then you won't see any symptoms, but then it will be inside you. That's that one is not good at all. It is better to see symptoms and then you treat it. But if you do see symptoms, these are some of the symptoms that men see. So the first symptom a man with gonorrhea may see is painful urination or pain during urination. When the person is urinating, you feel pains in your penis. This may be as a result of gonorrhea. The next one is swollen testicles. Your testicle may swell. Your testicle may swell. This is because of the bacteria infection you have. That's gonorrhea. Gonorrhea is caused by a bacteria, so this can cause swollen testicles. The next one is either a white or a yellow or a green discharge from the penis. So if you see yellow, green, or white discharge that is not normal from the penis, then you should be alarmed. The first thing you should do is go to the hospital and get checked. Go and get tested. They will test you. If it's gonorrhea, they will treat it for you. It's treatable up to a certain extent. So don't sit there and wait and tell me, how do you treat 7 years gonorrhea? How do you treat 3 years gonorrhea? How do you... No, go to the hospital. They will give you antibiotic. The men, they'll give you antibiotic to cure it. Okay. Now in women, if a woman gets gonorrhea, the person is likely to experience painful urination like the men. You will feel pains after you are done urinating. There may be increase in your vaginal discharge. Some discharges are quite normal. That will be my next topic, vaginal discharge and their meaning. Some discharges are quite normal, but then if you have gonorrhea, there may be an increase in your discharge, and it may either accompanied by some foul sense that is not regular with you. So this increase in your discharge can be a sign of gonorrhea. Painful urination can also be a sign of gonorrhea. And pelvic or abdominal pain, you may feel pains in your pelvis or your lower abdomen. It may be a sign, and you are not expecting your period or anything, so you don't expect to feel cramps or anything, but then all of a sudden you're having pains in your lower abdomen, or you are feeling pains in your pelvis, and you had sexual intercourse with either a new partner or even your old partner not long ago and you started feeling those things, you should get yourself checked. The last one a woman may experience is vaginal bleeding in between periods. Let's say you have your period last week and this week you are bleeding again the following week. No, you are expecting your period at a particular time, but then you keep bleeding in between those periods. It may be a sign of gonorrhea. Okay, if you have a 26-day cycle, it's supposed to come every 26 days. If you start seeing bleeding in between the periods, it may be a sign of gono. You may have contracted gonorrhea. Now, both men and women, if you have sexual intercourse, if you have anal sexual intercourse, like you do it through the anus, you may feel pain in your rectum. Your rectum may swell. It may be itchy. It will start itching. Your rectum will start itching you. You may feel pains there. It may even swell. Okay, and when you go to the loo to poo-poo, you may feel pains passing out the waist thing. Okay, so yeah, if you are experiencing that and you've had anal sex with a new partner or even your old partner, then it may be a sign of gonorrhea. Also, if you did oral sex with an infected person, then you may have throat infection and you may get sore throat. This one there, both men and women can get sore throat. If the woman has gonorrhea and you put your head down there, you get sore throat, you get throat infection. If the man has gonorrhea and you have oral sex with a person, you get sore throat, you get throat infection, you get sore throat. Now, gonorrhea is a serious STI. If you leave it untreated, in women especially, it can cause PID, pelvic inflammatory disease. You may have an infection in your pelvis, and this can lead to infertility. It can lead to either infertility or even ectopic pregnancy. Yeah. So if you feel any of the symptoms I've mentioned earlier, please go and get yourself checked. It can also lead to epididymitis, and it can cause infertility, especially in men. Okay, and it can also lead you to contract HIV/AIDS. Yeah, if you leave it untreated, you can get HIV/AIDS because your immune system becomes weak and you are ready to accept any disease that is passing by. Okay, the only way to know if you really have gono is to get yourself tested. You go to the hospital, you tell them the symptoms you are feeling, and tell them you want to test for a STI, and some will ask you which STI do you want to do, or you can just tell them, hi, I would like to test for gono or syphilis or anything, any STI you feel you may have. You just go to the hospital, they will test it for you. It's no big deal. It's treatable. If you approach it early, it's treatable. It can be treated and it will prevent a whole lot of things in your system. Okay, because it's a bacterial infection, when you go to the hospital, they will give you antibiotics. Now they have this dual antibiotics thing. I wouldn't want to dive so much into the medical aspect, but then they may give you antibiotic and then they may either inject you or something with. So they will give you two types of antibiotics. They will give you one to take for a period of time, and then they may inject you with one. I think that's how it works. Okay, but then yours may be different, your case may be different depending on the severity of your case. So maybe they'll give you one antibiotic to go and take at home, or they may give you the shot and then they'll give you the oral one to go and take. Now, this is how you prevent gonorrhea. The last part is the prevention. This is how you prevent gonorrhea. 1, get tested regularly. If you have multiple partners, I'm not here to advise you. You're old enough to advise yourself. You're old enough to advise yourself. Get tested regularly if you have multiple partners, and let your partner treat him or herself. If your partner has the infection, if you get an infection, then it's likely you got it from somebody. If you treat yourself and the person doesn't treat him or herself, the person will reinfect you again. This is simple logic. So when you get gonorrhea and you have one partner, that one is safe because you know who to go and talk to. But if you have multiple partners, then either you tell all of them to treat themselves or go and check themselves, or you use condom or use protection. Use protection by any means possible. The best thing to do is to use protection. But if you don't want to use protection, then get tested regularly and make sure your partner also checks himself or treats himself. So yeah, that is it for gonorrhea. Our next topic, we'll be talking about vaginal discharge and their meaning. Some discharges are normal, others are not. So before you put your head down there, make sure you know the color of the discharge and what it means. And the ladies too, before you go and say, oh, I have infection, make sure you know what discharge you have and the meaning. Okay, so yeah, if there's something you will be interested in, do want to subscribe to the channel, give this video a thumbs up, and turn on your post notifications so that we're notified the moment I upload the next video. I didn't want to waste your time earlier, so I didn't introduce myself. My name is Akosia. You can call me Pama, and wherever you see me, you can say hi, and we can just for some time before I leave. So yeah, thank you so much for stopping by the channel. I'll see you guys in the next video. I'm out.